So the origin story for Amcani starts back in 1998, and it's like most things in my life, serendipity. My little sister had moved to Cusco, Peru, and was hassling me to come down there. And due to where I was working on the faculty at Stanford at that time, I was the director of stereotactic functional neurosurgery, so I said, I'll put a neurosurgical team together, because she had identified a neurosurgeon at the county hospital who was in desperate need of help. Took a large team down there, and we did what I call the sort of standard, at that time, international medicine approach. So Westerners blow into the town, we do a bunch of cases, we left some supplies behind, and on the plane ride back, I was deathly ill. My colleague said, well, what do they do now? We're not there to help. And that launched this discussion between bouts of illness of sustainability. What does that mean, and how do we do it? And that's where Amcani came about. So my co-founder, Monica Gerstner, and I went through an incorporation process. We had no idea what we were doing. So we got articles of incorporation, filed all that, got our 501c3 stuff supplied. And again, serendipitously, I was looking for a casting about, because I could not go back to Peru because I was falsely accused of embezzlement. So for me to go back to Peru was to probably land in jail. So I said, no. It finally got straightened out and all that. It wasn't me. Yeah. And but at that time, I had started dating my then cherished wife, who was based in Hong Kong for work. And so we were together in Hong Kong and bored, and she goes, oh, where do you want to go? And I said, oh, let's go to Vietnam. I've never been to Vietnam. And we went to Hanoi, and I toured Viet Duc and Bach Mai Hospital. Nothing came of that relationship, and I came back and complained to my anesthesiology colleague, who's Vietnamese. And he said I should talk to his father, Tam Doc Bui, who is this incredible 80-plus-year-old guy who turns out was the dean at Heit Medical College. And I told Tom my story, and he goes, oh, don't worry, I have friends in Heit. And that's how we ended up at Heit University, 11 years ago. Being a neurosurgeon, we started in the neurosurgery department, and the neurosurgery department has flourished. They've gone from, I would say, probably working in a late 50s, early 60s level of neurosurgery, doing very simple, superficial cases, not for lack of talent or intellect or desire, but more for lack of equipment. So our first task was to uplift that department, which we did successfully. And they now work like a modern neurosurgical group, albeit with not as many tools as we have here in the States, but we're working on it. And as that progressed, as we got more and more tools for them, we started to realize the deficiencies in the other services. So we started a rehab program. We started a nursing education program. Last year we started vascular surgery. This year we're starting obstetrics and gynecology. So neurosurgery is an interesting department to begin with, because what it does is it does indeed demonstrate the holes in the healthcare system that you're working with, because the patients are very complex and sick. So that's sort of in a nutshell how we got going in Vietnam. And Myanmar, the program in Myanmar, is the same serendipitous. A colleague friend at my former place of employment, he's an orthopedic surgeon, and we would be sitting there late at night after doing late night cases in the doctor's room filling out of our paperwork, and he'd go, come on man, let's go to Myanmar, you gotta go to Myanmar. He's Burmese. And I finally relented. I said, okay, I'll go evaluate at Charles. And he set me up with 2 names and 2 contacts, and we went, and the first contact was at the University of Yangon, and they're pretty sophisticated. They were clipping an aneurysm when I was visiting there. Still pretty rough conditions, but they've managed to adapt, and they're already doing modern stuff. And some really interesting stuff too, stuff that the US would freak out about. That maybe I'll do a blog about. But they also introduced us to Relief International. And Relief International is an NGO that's working currently in Rakhine Province, which is in the northwest of Myanmar, and is called by the World Health Organization one of the worst healthcare systems in the world. And when I was talking to the country director, I said, nah, worse than Syria? Worse than a war zone? He goes, oh yeah. And hands me the 5 leading causes of death, and they're all preventable. Number 1 is pneumonia. Number 5 is rabies. And I've been there now, I'm about to leave for my 4th trip. And the last 2 trips, we've spent a lot of time in Rakhine province, and you can see what sort of the neglect over the last several decades of the healthcare system has produced. So we think for roughly $2 per capita, we can change that around. And we have sort of a component of, we have to change both the infrastructure of the hospitals. There are physical buildings all over the place that are called hospitals. Right. So we're going to rebuild those. We're going to try and add what they need. I actually have a pretty good idea of what they need. We're going to supply them with the capital equipment, commiserate with the environment they're in and what they wish, because that's part of our credo, is to develop a sustainable, local, culturally appropriate practice. And then we're going to train up the physicians to be able to do what they were originally intended to do, because the training there is rough and sparse. Mm-hmm. So that in a nutshell is where Amcani came from and what Amcani is going to try and do.
That's great. That's just what we needed.
Good. I'm glad I could provide.
Our first contribution here. Thank you very much.
You're welcome.